Hi, I'm Paul Schmidt. I'm a physical therapist and athletic trainer at Illinois Bone and Joint up in Highland Park. I want to talk to you today about a treatment technique that I use when I'm dealing with issues of the pelvis. Now, some of the issues of the pelvis that can happen are when you have a pelvic torsion or a pelvic obliquity, which would be an anterior rotation of one side of the pelvis or posterior, or you can have an in-flare or out-flare of the iliums. A lot of times when we try to correct these, the patient will leave, they have a symmetrical pelvis, and then when they come back the next time, the obliquity is back. Well, what's causing this? It can be caused by tightness in hamstrings, hip flexors, but one of the things that really can cause the problem is tension on the pelvic floor. So I want to show you a technique to kind of help relieve tension on the pelvic floor. It's called strain and counter strain for the pelvic diaphragm. And basically what you're going to do is you put your patient in side lying and you're going to bring their hips into flexion about 70 degrees and then their knees approximately 70 degrees of flexion. You raise their knees up about 6 inches on the floor. So I usually just have them relax their feet up on my leg like so. And then you find the iliac crest and you go about 2 inches below and you put pressure down. About 3 to 5 pounds worth of pressure, and you just hold this. Normally you hold this for about 2 to 4 minutes. A lot of times when you're feeling the pelvic floor release, you get a heat under your hand. Now it would be normal for you to feel warmth underneath my hand after keeping it here for a while, but a lot of times it can actually get hot, and you'll know that you're feeling a really good release, okay? So I would hold this position for about 2 to 4 minutes and then let them come down, flip them over, do the exact same thing on the other side. Now many times, I'll usually do that before I try to use a muscle energy technique or anything to correct the pelvis. A lot of times, just when you do this, the pelvis will be corrected, all right? A lot of diagnoses that this is good for is if people are having back pain that's referred from the pelvic floor, but most common how we see it in sports injuries are the one SI type of pains or hamstring strains, groin strains, or hip flexor strains that you just don't see go away. A lot of times it's caused because of a pelvic obliquity, and if you're able to correct the pelvic obliquity and it keeps coming back, try this technique because this really will help to allow that pelvis to stay or maintain symmetrical. All right, thank you.